Imagine your eye as a vibrant garden. The cornea, the clear window at the front, needs constant renewal to stay transparent and healthy. That renewal process is powered by special cells called limbal stem cells located at the limbus, the border between the cornea and the white part of your eye, the conjunctiva. But what happens when these crucial cells are damaged or depleted? This leads to a condition called limbal stem cell deficiency, or LSCD, a serious eye disease that can severely impair vision. In this video, we'll explore LSCD in detail, uncovering its causes, symptoms, diagnosis, and treatment options. LSCD occurs when the limbal stem cells are injured or destroyed, disrupting the corneal surface's normal renewal process. Several factors can contribute to this deficiency. Chemical burns, such as from acids or alkali, are a leading cause, often resulting from industrial accidents or household mishaps. Other significant causes include severe or recurrent ocular surface inflammation, like Stevens-Johnson syndrome or ocular cicatricial pemphigoid. Contact lens-related problems, particularly prolonged or improper wear, can also lead to SCD. Furthermore, certain genetic conditions, such as aniridia and multiple surgeries on the eye, especially those involving the limbus, can impair limbal stem cell function. Even radiation exposure can contribute to this condition. Let's delve into the underlying mechanisms. In a healthy eye, limbal stem cells continuously divide and differentiate into corneal epithelial cells, which migrate towards the center of the cornea, replacing old or damaged cells. This process ensures a smooth, transparent corneal surface. In LSCD, the damaged or absent limbal stem cells can no longer maintain this renewal process. As a result, the conjunctiva, which is the membrane lining the eyelids and covering the white part of the eye, starts to grow onto the cornea, a process known as conjunctivalization. This leads to the formation of an irregular corneal surface, the loss of transparency, and instability of the tear film, ultimately impairing vision. The exact prevalence of LSCD is difficult to determine due to the variability in diagnostic criteria and reporting. However, it's considered a relatively rare condition, but one with significant impact. LSCD can affect individuals of all ages and ethnicities. While some causes, like chemical burns, are more common in specific occupational settings, others, like autoimmune diseases, can affect individuals regardless of their background. Understanding the risk factors and potential causes in various populations is essential for early diagnosis and prevention. The symptoms of LSCD can vary in severity depending on the extent of the stem cell deficiency. Common signs include chronic eye pain and discomfort, often described as a burning or gritty sensation. Increased sensitivity to light, known as photophobia, is also frequently reported. Blurred or decreased vision is a hallmark symptom, resulting from the irregular corneal surface. Other symptoms may include excessive tearing redness and recurrent corneal erosions, where the outer layer of the cornea sloughs off, causing intense pain. In advanced cases, the cornea may become opaque and vascularized, meaning blood vessels grow into the cornea, further obscuring vision. Diagnosing LSCD involves a comprehensive eye examination by an ophthalmologist. The examination typically includes a thorough slit lamp evaluation, which allows the doctor to visualize the cornea, conjunctiva, and limbus under high magnification. Special dyes, such as fluorescein and rose bengal, can be used to highlight areas of corneal damage and conjunctivalization. Impression cytology, a procedure where cells from the corneal surface are collected and examined under a microscope, can help identify conjunctival cells on the cornea, confirming the diagnosis. In some cases, confocal microscopy, a non-invasive imaging technique, may be used to assess the limbal stem cell population directly. Furthermore, anterior segment OCT, or optical coherence tomography, can provide detailed images of the cornea and limbus, aiding in the diagnosis and monitoring of LSCD. LSCD can be classified based on the severity and the extent of limbal stem cell involvement. Partial LSCD refers to cases where some limbal stem cells remain functional, while total LSCD indicates a complete absence of functional limbal stem cells. It can also be categorized based on the underlying cause, such as chemical burn-induced LSCD, autoimmune-related LSCD, or contact lens-induced LSCD. Classifying LSCD helps guide treatment decisions and predict the prognosis. The treatment of LSCD depends on the severity and the underlying cause. Mild cases may be managed with lubricating eye drops, topical corticosteroids, and bandage contact lenses to protect the corneal surface and reduce inflammation. More severe cases often require surgical intervention. Limbal stem cell transplantation is a common approach, involving the transplantation of healthy limbal stem cells from the patient's other eye, if it's healthy, or from a deceased donor. Amniotic membrane transplantation, using a membrane derived from the placenta, can promote corneal healing and reduce inflammation. In cases where both eyes are affected, cultivated limbal stem cell transplantation, where stem cells are grown in a lab and then transplanted, may be an option. Keratoplasty, or corneal transplantation, may be necessary in advanced cases to restore corneal clarity. Recent advances include artificial cornea implantation and the development of novel stem cell therapies. Preventing LSCD is crucial. Protective eyewear is essential in environments where chemical exposure is a risk. Prompt and thorough irrigation of the eye following a chemical injury can significantly reduce the severity of damage. Proper contact lens hygiene and adherence to recommended wearing schedules are vital to prevent contact lens-related complications. Early diagnosis and management of inflammatory eye conditions, such as Stevens-Johnson syndrome and ocular cicatricial pemphigoid, can help prevent the development of LSCD. Regular eye examinations are also important for early detection of any signs of limbal stem cell dysfunction. The prognosis for LSCD varies depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and intervention can improve the chances of successful restoration of vision. Recent research focuses on developing new and improved stem cell therapies, including gene therapy and the use of induced pluripotent stem cells or iPSCs to generate limbal stem cells. These advancements hold promise for providing more effective and less invasive treatment options for individuals with LSCD. The field is constantly evolving, offering hope for improved outcomes and a better quality of life for those affected by this challenging condition.